The Centers for Disease Control and Prevention is facing questions over its credibility for repeatedly changing its guidance on COVID-19 and downplaying the pandemic. On Monday, the agency retracted new guidance it had posted Friday, suggesting the virus could travel beyond 6 feet through droplets in the air. The information was later removed from the CDC's website. A new investigation by USA Today looks at the multiple failures of the agency that was designed to lead the country through a public health crisis. A review of tens of thousands of internal records and over 100 interviews found the CDC repeatedly minimized the crisis under political pressure from the White House. According to the report, local officials were left to make life or death decisions on their own. Brett Murphy is a reporter on the USA Today investigations team. He joins me now from Milwaukee. Thanks very much for being with us. Your article tells the story of a person in California who was initially denied testing. Tell us about this woman who became known as Patient Zero.
So Patient Zero in California was one of the first cases in the country. We're in late February here. The case went undetected for quite a while, Elaine, because the testing criteria at the time was so narrow, despite most of the scientific community asking to broaden it so that they could see more cases. At the time, we just didn't know how many cases were already in the country because that testing criteria was so narrow. Meanwhile, this patient in California was transferred between two different hospitals. Hundreds of hospital workers were exposed and not wearing any PPE because they didn't know if she was positive. When she finally did test positive, the agency knew, CDC knew at that time that the virus was out in the country. We have an internal memo suggesting as much. But what was kind of remarkable to us was that a few days later, Dr. Redfield said publicly, I think it was 7 times at the task force briefing, that the risks to America remain low, whereas at that time, they knew that the virus was already spreading unseen around the country.
Well, what did you find about the White House's role in all of this?
So the White House has been, I think, repeatedly undermining the CDC. Our reporting has shown that. A lot of other outlets have been reporting that as well. It's come down to sort of an outsized role in what the CDC is allowed to publish, the guidance that they're allowed to put out. Normally, this has been an apolitical process in how the agency communicates with the general public and how they communicate with state and local officials. One of the stark examples was the weekly COVID reports. They're called MMWRs. These are sort of direct conduits of information. And we found, and Politico had reported before us as well, that White House officials were screening these reports, and that's just sort of the latest example. We've reported kind of throughout the pandemic that the White House has stepped in, held up guidelines from being released, let other non-scientific agencies weigh in, and that's had a really large role on what the CDC has been able to do, what they've been able to communicate. A lot of former officials and current CDC officials have told us that they feel largely sidelined. They have not had a big public position that they normally do in a pandemic, and that has also contributed to their sort of diminished credibility. A lot of people don't know where to look. And a lot of folks trace that back to pressure that's coming from the White House.
Well, according to your report, authorities from at least 13 states questioned the CDC over guidance that contradicted scientific evidence. If the agency was not basing their guidelines on science, what were they basing them on?
Well, it's tricky. I mean, this thing has been moving so fast, right? There's constantly new information coming out around the coronavirus. And what a lot of these criticisms have been, a lot of the frustration has been at the local and state level, is that the CDC's guidelines are not caught up with the newest information, with the newest science. So they might know better, or they're studying what the World Health Organization is putting out, or studying what the academic community and the scientific community understands. So they'll have a much different understanding of the disease than what the CDC is saying at the time. So they've been really frustrated over guidelines that don't seem caught up with the current science. They don't seem to always follow best public health practice. So that's been a real point of frustration for a lot of these folks. It just it's been slow, and a lot of the times they've even thought it's kind of been backwards, and so they've been frustrated quite a bit.
It's a really sobering report, but important in the midst of this pandemic. Brett Murphy, Brett, thank you very much for joining us.
Thanks so much.